Welcome, friends, and thank you for tuning into the Optimal Health program again today. We've got an extra special guest today. We're going to be talking about Lyme disease, the entirety of the picture, some really great in-depth information. This is a gentleman I've known for many years and have read all of his treatises in the way that you're supposed to evaluate and put together protocols for Lyme. Great information. Get your pad and your pen ready. Record this. Tell everybody about this. Statistically, Lyme is a horrendous bug, a horrendous disease. And as we're going to talk about in a moment, the number of people that worldwide have Lyme disease is staggering. I'm not going to take any of the oomph away from the comment, but welcome, Dr. Joe Burrascano. Joe, thank you for coming on the program.
Thank you very much.
Wonderful to talk to you and see you again. So,
thank you. Good to see you as well.
It's ultimately important to get information out to people, and that's what I've been trying to do forever. Being on the radio for a long time and then switching over to podcast, we love the idea that we can get on and interview people. We're not limited to time and such like we were on the radio, et cetera. But there's so much more to know now about Lyme disease than ever before, and I wanted this to be able to get out to as many people as possible. So you can certainly give us your overview. I know you started back in the early 80s, and you were one of the first people to hit the ground running with Lyme disease.
Yeah, I finished my training in internal medicine in the early 1980s and went back to my hometown of the Hamptons, opened an office in East Hampton, and I started seeing patients with a wide variety of very strange and unexplained illnesses. And when we became aware that Lyme disease was present, turned out we had the highest case rate of Lyme disease in the world in that part of town.
Wow.
And they did tick surveys where they collected ticks and analyzed them. And between 80 and 100% of the ticks were infected. So I fell into this, and it was at the very beginning. And me and a few colleagues, we worked out the best ways of testing at the time and the best ways of treating. So I was there really at the very beginning.
Wow. It's amazing. I've read also some of the information about, they think that Lyme had been in Montauk for many, many years prior. And I think I remember reading something about Montauk knee and researchers had saved some blood from a long time ago and realized that it was there, far earlier than we ever thought.
Oh, I was raised in Montauk, and there was an old town doctor at the time who was very, very smart, trains at Johns Hopkins. And he saw people who had this one joint, Montauk knee, monoarthritis, classic for Lyme, didn't know it at the time. He also found people who had these strange circular rashes that would expand, and they thought it was a spider bite, but he found if you gave them penicillin, the rash would get better. So this is back in the 1960s already.
Wow.
So he was way ahead of his time.
Wow. Pretty amazing. So primarily people started to hear about it in the late 70s or so, from people that were evaluated in Lyme, Connecticut.
Well, see, that kind of goes back to the important history of Lyme and why we still have so much trouble with this illness. Back in the 70s, when the CDC came down and did some research, they didn't know what it was. They thought it was an autoimmune disease, maybe a virus. They weren't sure. But then Willy Bergdorfer, who was a tick researcher from the NIH, he came to Long Island and went to Shelter Island, which is a small island off the coast. And he collected ticks there, and he found the spirochete they call Borrelia burgdorferi. They named it after him. And they found that spirochete in the tick, and that became the beginning of the whole thing. But the problem is this one specific strain and species of Borrelia, the Lyme germ, that he used, it came from a tick. It didn't come from a human being. But nevertheless, this one specific type of germ became the type strain or the prototype for all Lyme disease testing and research all across this country and even in Europe to some degree. And the problem is, we know that the ticks and the germs they carry, especially the Borrelia, they vary geographically. So it's very unlikely that a germ, a spirochete from a tick, and not a human being, from an island isolated off of Long Island, New York, represents all of Lyme disease. But unfortunately, all the tests until now were based on this one species, this one strain. And so many people who had Lyme got a test with this type of germ, and nothing showed up because they had a different strain, a different species.
Wow.
And it's only now that they've realized this, and the better labs, like Genetics Lab, for example, they recognize this, and their tests will encompass all the different strains and species.
across the country here, and I know Northeast and South, and then at the West, and I imagine Lyme is in every state in the country. How
Yep.
much variability is there with the different strains?
There's enough variability that the testing can become unreliable. Another huge thing that was found fairly recently was that there's an illness of Borrelia that's not Lyme disease. It's called relapsing fever. And relapsing fever, if you read the textbook, is a very distinctive illness where people get extremely high fever and then they break it with a sweat. And over the next few days, they start to feel better again. Then it relapses maybe 5 to 7 days later, with a high fever and sweat. It's a very distinctive thing. And so no one expected that to show up in Lyme patients. But a study was done where they found, in some cases, half the patients who presented like Lyme disease with the monoarthritis and the tingles and all the other things did not have Lyme, but had relapsing fever. So apparently, relapsing fever can act like Lyme and present like Lyme, but none of the Lyme tests until now, none of them have ever been validated for relapsing fever.
Wow.
So right away, off the top, you're taking away half the patients who have Lyme or Lyme syndrome, and you're not diagnosing.
Wow. This is it's mind-boggling to say the least. So yeah, the accuracy of testing has gone from looking at some local lab or some of the common labs that really don't do the great markers. Now, the ELISA test, the two antibody test that was done originally, that was just not an accurate test at all. And that's why you've always recommended the Western blot.
Well, there are different ways of doing tests. And the original way of testing was what was called an IFA. That was replaced by the ELISA, which is the same test, but now the ELISA is an automated version of it. A more detailed test is called the Western blot. But all those I just described, the ELISA, Western blot, they're all based on, again, that one tick germ that came from Shelter Island, New York. It's
Wow.
not based upon the reality of what's out there. So you're missing at least half of the cases just right off the bat. And because these tests are made, I don't want to get too technical here, but what they do to get the test done, the test contains what are called antigens, which are protein particles of the germ. And then when the patient's blood is added to the test system, if they have antibodies, in other words, recognition of the infection, the two come together and test becomes positive. So the question is, where do they get these protein antigens from the germ? Well, with the ELISA test and the Western blot and the IFA test, they take a spirochete, again, this tick strain that is ridiculous, and they break it up, they sonicate it into millions of little pieces, and they use that as a basis of the test. The problem here is that germs have a lot of different proteins that are in common with other germs. So this test can not only pick up Lyme, but it can pick up syphilis and
Wow.
autoimmune diseases and everything else. So you get a lot of false positives. So what they do is they turn down the sensitivity of the test to get rid of some of these false positives, but then they end up getting a lot of false negatives. So that's why a study was done and published. They picked up about 50% of cases.
Wow. So it's never been more true than you have to make the diagnosis clinically and use the testing as, added information.
Well,
Wow.
it's a clinical diagnosis, but then nowadays, thank God we have better testing. We have, for example, the immunoblot test, which comes from a specific lab in California called Digenix. And their immunoblot is not made from sonicated whole germs. It's recombinant lab-created proteins that they can be very, very specific. So you pick up all the different strains and species, not just that one tick strain. And you pick up the European strains, the South American strains, all of them on this one test. So the
Wow.
testing has gotten so much better. They also offer that kind of a test for the relapsing fever, so that can be included. And in fact, they even offer that test for the other co-infections that come with tick bites, like Bartonella, Babesia, and others.
Wow. Amazing. So we had a little chat before we came on, and we were talking about worldwide exposure to these organisms. And your comment was that 1 in 7 people test positive for Borrelia.
Yeah, when that article came out a number of years ago, it was like blew everybody's mind. The statistic is one, it's estimated. I mean, they haven't tested everybody on the planet, but it's estimated that 1 in 7 people on this entire planet, or 14% of the world population, has been infected with Borrelia at some point in their lifetime. Is that
Wow.
crazy?
It's staggering, because we've always thought that this is something that typically started here in Connecticut and, Long Island, et cetera.
Yeah.
But people don't realize that these creatures, either have been here for an extremely long time and they've been everywhere. I can't think that, we're taking these things and, they just somehow migrated with us to other countries. So they would have had to be here, worldwide for a very long time.
Well, the famous case was Otzi the caveman, or the Iceman, I
Ah,
should
yeah.
say. He was the mummy that was found in the Alps when the glacier melted. He was 5,000 BC is where he was dated to,
Yeah.
I believe. And they found relapsing fever in him. He had a big monoarthritis in one knee, and some other chronic things wrong with him. They found on examining the body. And they found Borrelia in him, but it wasn't Lyme Borrelia. It was this relapsing fever Borrelia, which, like I said, can mimic Lyme and often goes undiagnosed. So yeah, it's
Unbelievable.
5,000 years ago or more that we have documentation of Lyme disease.
Wow.
Yeah.
That's as amazing as you could imagine. So, what are your favorite? And I understand the testing. The testing you've discussed are these are great tests, very very important. I think IGeneX is a wonderful company as well. What are your favorite medications to start treatment with a person who
Ah,
has
here we go.
clinical picture, and let's just say for discussion, just Lyme and not the cofactors as yet? What is
All
your
right. Well,
go-to?
you know, you can't really talk about Lyme without talking about the co-infections, okay?
Hmm.
Because the ticks, I mean, think of it. Ticks are nature's dirty needle. They live in the dirt. They drink the blood of a whole bunch of wild animals, including birds and reptiles, depending where they are. To think they pick up just Lyme disease is
True.
crazy. And so when you analyze the tick, you find a number of different Borrelia. You find Babesia, which is a blood parasite like malaria. You find viruses. You find rickettsias and ehrlichias and anaplasmas. I mean, the list goes on. You even can find nematodes, which are roundworms. Whether they get transmitted from a tick bite, nobody really knows. All right, so knowing all that, let's say someone comes to you and they just got a tick exposure. Maybe they have a rash, maybe they don't, but they're starting to get sick. What do you do? Well, people nowadays like to start treatment with doxycycline. Why is that? Doxycycline is kind of a broad purpose antibiotic. It can impact Lyme disease. It can impact the rickettsias, ehrlichias, anaplasmas, and all those. Why that's important is Lyme disease, if it's not treated properly or untreated, can really go on to become a chronic, long-term, lifetime illness. But the rickettsias, in some cases, can be fatal. So the best treatment for rickettsia is doxycycline. However, doxycycline is a terrible treatment for Lyme disease unless you push the dose to such high levels that it's hard to tolerate. Because doxycycline does not kill the Lyme germ, it suppresses it. Only when you get to high doses like 400 to 600 milligrams a day will it, number one, kill the germ, and number two, pass into the blood-brain barrier and get to Lyme where it's being hidden. So starting treatment with doxycycline is done to make sure the fatal diseases don't happen. But even with doxycycline treatment, people go on to get Lyme disease anyway, despite that. So what I like to do is what I call a hybrid treatment. I'll give doxycycline for the first 2 weeks to make sure the rickettsias are covered, then switch over to a more appropriate medication for Lyme, such as one in the penicillin or cephalosporin family, which does kill the spirochete, not just suppress it. So we'll do a couple of weeks of doxycycline, then usually 2 to 4 more weeks or longer of the other type of medication. And that way you cover both bases and better.
Which is your favorite cephalosporin?
Orally, I like the drug called Ceftin, known as cefuroxime. Intravenously, the one most commonly used is ceftriaxone, known as Rocephin.
Hmm. Great. Are there other things that you might do along with? I mean, do you correct vitamins, minerals, and such for these individuals who are looking at kind of getting their immune system to get a little bit of a boost or having better vitamin D levels on board?
Well, I mean, that's a huge topic and a very important one to discuss. You know, there's a spectrum of treatment for tick-borne illness. And, again, we'll talk more about the chronic form when someone comes in, with fatigue and headaches and body aches and the brain is not really clear and they're forgetful and all that. So it's a chronic illness. So then what is it? Well, on the one end of the spectrum, you find people need support. They need support for the mitochondria using specific nutrients. They need detoxification to get out the heavy metals that build up and all the
Hmm.
other things that happen with Lyme, because Lyme inhibits normal detoxification. And people with chronic Lyme get toxic with heavy metals and mold toxins and lindane and other things like that, insecticides, glyphosate. You
Hmm.
find that in these people if you can get them tested well enough. So one end of the spectrum is you clean up the terrain, as we call it, get all this cleared up, and then people start to really feel better. But you haven't addressed the infection. On the other hand, people go, so it's an infection, we'll give you an antibiotic and you're done. Well, no, because you haven't addressed all the other things I just discussed. So what you really need to do is clean the terrain.
Hmm.
As I said, Lyme inhibits the detoxification process. So toxins build up, which would not build up in people who don't have Lyme. And so that's important. Second thing, Lyme damages your metabolism. And you need good energy production for your immune system, for your brain, for healing. And if you don't address that, things are going to go slow or not work out at all. Lyme damages the immune system to some degree, can be very badly damaged. And so you need immune system support as well. And if you're co-infected with Lyme and some of these other tick germs, those impacts are actually worse.
Which do you think are some of the better go-to meds for Babesia, Ehrlichia, Bartonella?
Well, it's hard to say a go-to med because every patient is different. Now, for example, with the Lyme disease, we talk about ceftriaxone as being used a lot as an intravenous and cefuroxime orally. It turns out the Lyme germs are pretty sneaky. They know how to hide from not only the immune system, but from the antibiotics. They go into a dormant state, a persister state, where these antibiotics, doxycycline included, have no effect on them. So then you have to go to third line drugs like daptomycin or certain herbal products and botanicals that have been proven, at least in the test tube, to work against these persisters. So when you're starting to treat Lyme disease, you're going to use standard medication, be it high dose doxycycline or one of the cephalosporins. You're going to add to that something for the alternate forms of Lyme. Lyme germs form cysts. They get into biofilms. They do a lot of things to hide. So you might want to add a drug like metronidazole, which gets into the cysts. You may want to use a drug like daptomycin, which works against persisters. And you definitely want to add the botanicals if you can. So that's just a basic starting point for the Lyme disease. And then you give the treatment for a number of weeks and see how the patient does. And if they're improving, you continue. If they're not, you switch. Meantime, for Babesia, Babesia seems to be becoming resistant to treatment. In the earliest days, we used a drug called pentamidine, which you can't even get anymore. It was a horrible injection. It didn't always work. So then they came up with a combination of clindamycin and quinine, which is still talked about, and it has a high failure rate. It's very hard to tolerate. The next improvement was a combination of atovaquone, which is liquid called Mepron, combined with azithromycin or Zithromax. So Mepron and Zithromax together has been the standard for Babesia. Turns out there are people who get that treatment and don't get over it. Now they're using a newer drug called tafenoquine, which really can help, especially if you combine it back with some of the earlier agents. So that's an evolution there. When it comes to Bartonella, nobody knows. One of the most effective medications, in my experience, are one of the most toxic medications, and those are the fluoroquinolones. Drug like Floxin, for example, really works well, but a high incidence of side effects, including nervous system irritation and even tendon problems. So people have gone away from that. But Bartonella being hard to kill, it's what they call a stealth organism, hides away from the immune system and other places it gets biofilms. Um, Always stuck with using a combination of at least two and generally three different antibiotics. So Bartonella is very tough.
Boy, oh boy. Have you continued to write your papers on the protocols? Because I remember you had done
Well,
that for year after
I
year.
kind of became famous or infamous because, in my office, I was treating more Lyme patients than anyone else that I know of.
Yeah,
So I was
yeah.
getting calls several times a day from various practitioners saying, gee, I have a Lyme patient. How do I diagnose and treat it?
Hmm.
I mean,
Yeah,
I'm running around. I don't have time to take a lunch or
yeah,
go to the bathroom, let alone to give a 20-minute lecture on the phone.
yeah,
So I
yeah.
said, I'm going to write this up. So I wrote up a protocol, how to diagnose and treat. And so someone called, the nurse would say, don't bother him, he's busy, but I'll send you the protocol. And then what I did over the years, I revised and advanced it and so forth. And I think I haven't updated in a long, long time. I left practice in the mid 2000s, and I work in the biotech area, but I haven't updated the guidelines since then. But they're still available online. They're free. They were never charged for it. And they've been translated into a number of different languages, and it's still a pretty good resource.
Yeah, absolutely.
So yeah, it's a good starting point for a lot of people.
And you're still doing lectures and conferences, and people can watch your lectures and view this online?
Yep. I do dedicate a lot of my time to education. I'm one of the founding members of the International Lyme and Associated Diseases Society and also of their educational foundation. And as such, we train physicians, nurse practitioners, chiropractors, all the different allied health professionals. And I give lectures and webinars all the time. Just came back from Texas, and then I did another seminar in Connecticut. I'm always doing that. And thanks to Zoom, I'm doing a lot more than I would otherwise have. So yeah, I'm still very busy educating.
That's wonderful.
A number of my videos are online, um, and they're
Is there
free
somewhere
if you want to
specific
watch them.
online for people to look?
Oh, I have no idea. I don't have my own webpage.
You
I'm
just
not
put your name
commercial
up,
in
yeah.
that sense. So just do the search.
So, Frank, if you have questions,
We do. Hello, doctor. Great to have you on.
Hey,
This has
Frankie.
been
Hi.
awesome. And a lot of the questions kind of relate to my own personal question with a small story. So, for someone like me who last year I'm having a nice walk with my dog, then the next morning I'm having my shower and then I see, oh my goodness, that is a tick. My wife's running in with the tweezers and I run right to, City MD or, Doc in the Box, one of those, just running to say, oh, what do I do here? And my personal experience was like, oh, well, it was only in for a day max. Okay, well, there's no red ring around. Okay, well, you don't really need the doxycycline.
Doxycycline.
And I was like, give it to me, please. I don't care. Let's just assume I have it, please. I'm not going to go to sleep at night. So, what are your thoughts for someone who just sees a bite? Like, what should they do? My question.
Okay. It's a very big discussion, a very important one, because it's been said that you have to have the tick attached to 24, 36 or more hours for it to transmit infection. Well, it's absolutely not true at all. First of all, those studies were based on animal studies, some of which don't get the kind of Lyme that humans get. Second thing is that Willy Bergdorfer himself said it's not so much the fact that the tick has or doesn't have the infection, it's where the infection is in the tick itself. When the tick bites someone, the first thing it does is it injects its own saliva, and the saliva is anesthetic, and that's why you don't feel a tick bite. But in the saliva are other things that are injected, things that prevent the blood from clotting so it can drink the blood, things that inhibit the immune system so it doesn't get a reaction to the tick itself. But in the meantime, if there are germs of some kind in the saliva of the tick, they get infected or they get transmitted and cause an infection immediately upon the bite. So Willy Bergdorfer, again, the discoverer of the Lyme spirochete, he himself said about 10% of ticks have the Borrelia of Lyme in the mouth, in the saliva, so the bite can give the infection immediately. Relapsing fever, the cousin to Lyme, they found that it's always in the saliva and transmission is less than 30 seconds in some cases. One report I found, 15 seconds in transmission. Babesia are found in the mouth parts. Bartonella, if it's in the tick, some ticks have it, some ticks don't. That's found in the mouth parts. And so transmission time is really not the issue. The issue is, was a tick in long enough to cause a reaction in the skin, a little welt, a little bump? Was the tick engorged? Did the tick come from an area where Lyme and other infections are known to occur? So, for example, where I started practice, where 80 to 100% of the ticks were infected, if you got a bite where the tick was irritating you, which means it injected its saliva and it's starting to fill up with blood, that's what I call a high-risk bite, and I would recommend treatment. If someone was walking, they found the tick crawling in them and just started to attach, you pull it off and there's no blood contact, that's a low-risk bite. You don't do anything. All right, so if it's a high-risk bite, if it's some tick that's starting to get engorged, your body's starting to react, you're not going to get a rash. If you get a rash at all, the statistics are varied, but usually 50% or less don't get a rash. So even if you do get a rash, it's not going to occur for a week or two after the bite, so you don't look right away for a rash. If it's a high-risk bite, then you have a discussion with the patient. The risk is there. you can either watch and wait, or you can take a preventative antibiotic now. And that's a discussion you have to take on an individual basis with the patient and get their consent.
Another important question that's always, been on our minds is that for people that will do the blood test for Lyme, whether it's the general labs or obviously, as you're saying, the better lab to use is IGeneX, does it take some time before that blood test can turn positive? So within the first week or 2 weeks, are you likely going to get a positive test, or does it take a little bit longer than that to turn?
If you use standard testing like you get in the hospital or the walk-in clinics, you really need to be infected. Not that you want to be infected, but the infection has to be there at least 4 weeks, preferably 6 weeks, before the test starts to become reliable. And what they're supposed to do is take a blood test at that visit and then have you back in 4 weeks and redo the same blood test and compare if it's changed a certain amount. And that's an indication that infection is building up. But then again, that means that you haven't been treated and now the infection's there. What are you going to do? And statistics from the CDC show that even with early treatment, 30% of people go on to get chronic symptoms. But then, they're told, well, you've had treatment. And by that point, the medication negated the blood test, so it may not show a positive. And they say, well, you've got menopause symptoms, or you're overworked, or you're not eating right. They blame the patient, or you're having a depression episode, when in fact you have an infection that they're just not recognizing. Now, the newer testing, the immunoblots, their sensitivity is higher. So usually by the third week, fourth week, you can start to get positive. Some clinicians report as early as 2 weeks. The lab doesn't have a comment on this. It's just research or observations of the clinicians who use the test. But still, if someone comes in with a high-risk bite, you may want to take the test or not, but you're not going to use the test to determine what the treatment's going to be. I mean, if someone has a high-risk bite, or if you're a high-risk person with a low immune system, or it's a pregnant person, you're going to want to treat the person and not wait for the test to come back.
For some individuals that have been tested negative, and I've seen this many times, they've been with the regular test, hospitals and otherwise, 3 or 4 times tested, either negative or borderline, where they have a couple of IgG or IgM bands on Western blot. Have you seen that when those people are put on antibiotics to try to treat what clinically is Lyme disease, that the blood tests tend to turn positive after that?
Oh, yeah, that's a very well-known phenomenon. Early on in the infection, the immune system, which makes the antibodies, the immune factors that the tests pick up, they start off in low amounts, but the infection, the germs, are there in high amounts. And the antibodies, the immune factors, bind to the germ together, and the two form a complex. They call it an immune complex. The problem is the test doesn't measure that. The test measures only freely circulating antibodies. So if you have an overwhelming or a large infection or a weakened immune system, you're not going to get a positive test. So if you start to treat that person anyway, what happens is the number of germs starts to decrease and the immune system starts to heal and makes more antibodies, and then the test becomes positive. So I did a series on this in my own patients, and I found that if the person truly has Lyme disease and gets treatment and they're negative in the beginning, they convert to positive 37% of the time. So it's not a small amount. It's more than a third.
Wow.
So just another question that a few people have been asking in the chat. People get their dogs, right? They'll get a vaccination for Lyme disease. And people are kind of just asking, like, is that even a real vaccine? Because couldn't a vaccine for dogs eventually get to humans? So people are just kind of asking about the veterinary. I know you're not a vet, but people are curious.
Well, sure. I mean, how could the dog get a Lyme vaccine and I can't,
Exactly.
Well, first of all, I have to say the vets are always ahead of the doctors. I've seen that from day number one, but that's just a plug for the veterinarians. Well, you got to go back in history. Back probably, when was it? 1990s, I guess. I don't even remember. They did come out with a Lyme vaccine, and it caused a lot of problems. A lot of people got permanent arthritis and neurologic conditions, and there's a class action lawsuit against the vaccine company, so they withdrew it before the lawsuit actually caused any trouble. But anyway, the problem was they made the vaccine of one of the proteins from the germ that actually causes the arthritis and nerve problems. So your body's immune system thought the infection was there and all this inflammation happened. It was a disaster. So now they're working on a new vaccine which uses the same type of approach, but the chemical in it to make the person immune is a fragment of the original. It's like incomplete. So the thinking is it's not going to cause all these terrible side effects. And the research is still going on. Nobody really knows. But the flaw in this whole thing is that, again, you're maybe preventing Lyme disease, but you're not preventing Babesia, Anaplasma, Ehrlichia, Rickettsia, Rocky Mountain spotted fever, Bartonella, all the other things, the viruses that come along with it. So number one, you can get a tick bite and still be sick. And number two, you can get a false sense of security that, oh, I had the vaccine. I can go out in the woods and do what I want. I don't care if I get a tick bite. Well, I think you're going to end up getting a lot sicker than you thought. So first of all, I don't know if the vaccine works. Number two, if it does work, does it have side effects that are worse than not taking it? And number three, you still have to be vigilant. You still have to avoid the tick bites and get rid of the ticks as soon as you can.
Yeah, there's also comments about the things added to vaccines, which are numerous, including aluminum and mercury. So that's always been
that's right. The new
hotbed.
vaccine, the new Lyme vaccine that's being researched right now uses alum as the adjuvant. What that means is that the vaccines themselves don't develop enough of an antibody response, so they put something else in with it to irritate and stimulate the immune system.
Wow.
And the one that's used in this vaccine is called alum, which is aluminum derivative. Now, the amounts are very, very tiny, but still some people are concerned.
Even so, as you were talking about before, the different strains compared to that first, quote, original prototypical strain, with the vaccines, would they work on all the different strains of that same bug, or would they just work on the original? Yeah, I mean, there's so many questions.
Yeah, well, see, it's not really clear because, again, the vaccine is directed against one of the proteins of the germ, but not every germ makes every single protein. So there are definitely going to be strains of this germ that will escape the effect of the vaccine. How common will that be? I don't know. Will they make different vaccines for Europe and different ones for America? Probably not. And so it remains to be seen what's going to come of all this.
Do you think that people in other countries become more ill from their exposure to that Lyme compared to some people here? Just as a off the top of my head question.
It's hard to say because the statistics on Lyme are very poor. Again, they use these bad tests to try and make a diagnosis. We know that some of the European strains present a little bit differently. One called Afzelii, Borrelia afzelii, can cause a strange rash on the skin if it's chronic, called ACA. The one called Guerinii is more likely to cause a neurologic problem than the American Lyme, which is more arthritic. But these are just generalizations. There's a huge overlap. And we do have those other European strains in America for a variety of reasons, especially because people and their pets travel and birds carry ticks and they carry them from country to country.
Compared to individuals, quote, walking in the woods, which people have this idea about because it's been talked about for so long, how many people do you think will pick up exposure from their pet, the dog, the cat, who might be in the woods or out and about running around, etc.? Or other animals that are nearby, ticks and such that live in close proximity?
Well, you can say two things about that. One is that, sure, there could be some ticks unattached to the animal that get in your bedding or wherever, and then they attach to you. But also means if you have an animal that's outside and comes home full of ticks, it means you have a lot of ticks in your area and you're at risk just by going out. And, studies early on have shown that often the highest concentration of ticks are in the shrubbery around the base of your foundation if you have a private home, or at the border between the lawn and the woods. So, there's very few areas where you're completely safe. People put up bird feeders, the seeds drop down, the mice come to eat the seeds, and they leave a trail of ticks behind. So, it's really tough.
Wow.
Yeah, that's true. That's what happens.
It's just the possibilities are staggering, and I still can't get over that. Yeah.
You can do preventive measures. There's picaridin is something you can put on the skin, is better than DEET. There is permethrin, which can go on clothing and shoes and so forth. But I have to tell you, a great study in Connecticut. Ticks sit on the blades of grass and vegetation, and they have 8 legs in a spider family. So the back legs are holding on, and the front legs are sticking up little pinchers. And they're just up in the air, and they wait for you to come by, and they grab onto your clothing, your socks, whatever, and there it is. What they found in Connecticut was a nudist colony, and they didn't get tick bites. So you can bring ticks by using sprays, or you can just take off your clothes.
Well, I said that's almost the beginning of a science fiction movie, but then the nudist didn't get the ticks. Wow.
Yeah.
Fascinating. Wow, it's amazing when you look at the reality and the specifics of all this. And honestly, I know a lot of doctors and they don't have a clue. They'll typically look at the one blood test that they've been told to use for years and just don't understand any of this. So the Prometheum, that you can put on your clothes and your shoes. And what was the second one?
It's called picaridin. It's a spray. It comes also as a liquid you can just use, rub on. But that's
Picaridine.
it's
Okay.
a botanical type of a product that does repel the ticks, and it's safe to put on your skin.
I have a gentleman that comes over and he uses a chrysanthemum extract. It's all healthy organic spray to put around the
Yeah.
house to protect against ticks and mosquitoes and such. And that seems to be, keeping some of these creatures at bay. I wonder how well that would work on the ticks if you think that
Well,
that's,
none of them are 100%, but better to do something than nothing.
yeah. Yeah,
So,
we don't see the mosquitoes at all since he's done that.
Yeah, right,
yeah.
good.
And that was a big question that the crowd was asking, just how can I avoid, besides, putting off spray on, how else can we avoid that?
Doesn't
So,
NASA make these lightweight suits that you can wear around?
So
Wow.
one other one is just, what are some common myths or misconceptions about Lyme's disease you wish more people understood? It's a big one.
Well, one thing is that it's very easy to get. It's very difficult to diagnose. So many people with so-called chronic conditions are told they have this, that, and the other thing, when in fact it could come down to being infected with Lyme or one of the co-infections or all of them. I can't tell you how many people have, been told they have chronic fatigue syndrome, or they're depressed, or maybe they're malingering, or based on menopause, or you have autoimmune disease, or hormone problems, or misdiagnosis, multiple sclerosis, or other forms of neuropathy. So one big thing is, if you're sick, things happen for a reason. It's up to the medical, personnel to find out that reason, not just slap a bunch of symptomatic treatment on top of you. So one thing is you got to get to the bottom of it. And if the test doesn't show what you expect, use a different test. Find, be as thorough as you can. You don't want to miss an infection that can be causing chronic, lifetime illness. So it's one thing. The other thing is the treatment. As you said, there's misinformation about tick attachment times, and that's a big one. Second thing is another thing that became popular, and it's so wrong, I can't believe it's not a malpractice case, and that is using a single dose of doxycycline if someone comes in with a tick bite. The study was done using mice where they gave it a single dose of doxycycline, and after they gave it a tick bite, and they said, I didn't get Lyme disease. That was based on some kind of a non-specific marker. They never followed the mice over a period of time. With people, they never follow the people over a period of time. And it's been found that one dose of doxycycline is not high enough in milligram or in the body long enough to kill the germ. These germs are like blocks of soap underwater. It takes a long time to dissolve them with your medications. It takes days and days of antibiotics to just kill a spirochete. So a single dose of doxycycline is completely useless, completely wrong. And, the informed physicians who know about this, they try and change the world, but no one's listening. They're still giving the single dose doxycycline. It's in some textbooks too.
Yeah.
Crazy.
I remember getting phone calls from pharmacies that say, oh, you gave us the wrong dose. I said, no, 100 milligrams 3 times a day. I said, that's the right dose because I think the patient has Lyme disease. And they also, if they're not, better educated about it, will recommend the twice a day dose. But as you're saying, you certainly can't use once a day.
Well, I did a study with my own patients. It's funny. Some patients, you give them the treatment, they did well, and that was it. Other people, you give them the same treatment, and they're the same weight and age and gender, and they don't do well. So I said, something's going on here. So what I did was I thought, maybe they're not absorbing the medication. Maybe they're metabolizing it, they're eliminating it, something. So what I did was after I put them on the medication, I took their blood level test. I measured how much antibiotic was actually in the bloodstream. And I found a crazy thing. With a medication like amoxicillin, one of the penicillin drugs, the variability between the low blood level and the high blood level in people who are on the same dose with the same weight, same age, everything, was like 100-fold variability. Some people didn't absorb it at all, had a blood level of 0.1 when you need a level of 12 or 13 to kill the thing. But doxycycline was a 10-fold variability. So I found that you really need to start with a relatively high dose. If you're going to have someone on medication for a prolonged time because it's a chronic infection, if you can do it, always check a blood level. Another case, I had a patient came in with with early Lyme. She had the EM rash, was starting to get sick. I gave her a strong dose of cefuroxime, a good drug for Lyme. As weeks went by, she was not getting better. So I did the blood level test. Her level was like 1. And again, you need 13, 15. So I switched over to a different drug, this time doxycycline, and this time was 400 milligrams a day. Her blood level was fine, and she completely got over it. So sometimes treatment failures are not because you're treating the wrong infection or because it's the wrong drug or the wrong dose, but maybe the person's not absorbing it well. And if you can get a blood level test, that makes a huge difference.
So a while back, we were speaking about your interest in research, and you've done a great deal of this. And I know that you had created a mechanism to look at the actual bug itself, the Lyme antigen, as opposed to just looking at antibody tests, because initially, as you're describing, the antibody tests were not, terrific, for looking at all the different strains of that bug. So I know that's not available in New York, but people can get that in Connecticut or Pennsylvania?
Well, every state other than New York. Yeah, we're talking about culture testing, where you
Correct.
actually take a sample of blood, you incubate it for a number of weeks, and then after that, you test it, look for the organisms. The original research was done by Alan McDonald back, I guess, in the late 80s. I worked with him and I supplied the patients, and he told me who was positive and negative. That's how I learned an awful lot.
Wow.
Later on, I introduced him to Eva Sapi, and the two of them worked together, and she developed her own methods, and she uses that in her research. Then a company in Pennsylvania called Advanced Labs hired Eva to set up a culture lab for them, and they did that for a number of years, but they never made money, so they closed. Now IGeneX has picked up on culturing, and they offer cultures for the different Borrelia, the Lyme relapsing fever, as well as the Babesia and the Bartonella, the Rickettsias too. But the thing that's interesting, the culture is a kind of a test where you're looking for the germ. So like if someone has a bladder infection, you don't take a blood test to see what's affecting you. You look in the urine and you culture it. You stick it in the test tube and you incubate it. So there's a patient who was diagnosed with chronic fatigue syndrome, was sick for many years, 2 years, 4 years, I don't know exactly what. And they couldn't find out what it was. So out of just being complete, they did the culture test on her for Babesia. And she came out positive, but it wasn't a Babesia they found. They found a germ called Culpadella. So what is Culpadella? I never heard of that before. Turns out it's a single cell protozoan that lives in pond scum and in the soil. And in the worldwide literature, there are only 2 cases of people ever being infected with this. Well, turn out here's number 3. So the lab, of course, didn't believe it. So they sent it out to an outside lab for DNA sequencing, and it was confirmed. So they didn't believe it again. They sent us another sample. Again, the second one confirmed. So now the poor clinician says, I have this, 3 people in the whole world have this infection. What do I do with it? So because it's kind of like a Babesia malaria kind of a protozoan, he used Babesia treatments. And lo and behold, the woman got completely better. So years and years of chronic fatigue was fixed by this one test.
Wow.
So again, the moral of the story is the testing has gotten so much better, but you have to know about it, and you have to be willing to not just do one blood test, but do a series of tests, do a panel, some based on the immune system, some that are direct tests, some that are blood smears. You do what you can because the patient's life depends on it.
Could you comment on the CD57 test? I think you're alluding to that as one of the immune markers that may show positive.
Yeah, no, the Lyme germ inhibits and can actually kill some immune cells, like the B cells and the T cells. Turns out they inhibit the maturation of the killer cells. And the killer cells develop into what's called the CD56, which fights viruses, and then CD57, which fights other like bacterial infections. It was found a number of years ago that people who have active Lyme, and especially with co-infections, their CD57 count can be low. And so we found that to be a pretty useful marker. It's not 100%, but a reasonably useful marker for, number one, disease severity. A very low number means generally a worse infection, and you'll need more aggressive treatment, maybe more prolonged treatment. We also found that over time, if the person got well and the CD57 test still was low, that pretty much guaranteed a relapse. But if they got well and the treatment ended and CD57 was okay, then they usually did not relapse. So it's not a solid marker for Lyme disease, but it's one little trick.
Yeah, it's great information.
To help them guide it.
It's you're trying to use as many different types of information as possible to make a more clear picture and to guide you as to how to treat and how long to treat.
Yeah, but it goes both ways. Lyme is a great mimicker. It can mimic so many other illnesses, but there are other illnesses that mimic Lyme. So part of a good thorough evaluation is just to make sure there's not something else going on. The patient might have hepatitis or HIV or a cancer or something. So you have to be very thorough, do a good thorough evaluation of the patient. And then sometimes the tick-borne diseases become a diagnosis of exclusion. And you kind of, with informed consent of the patient, say, well, let's just try some treatment. And then after the 4 to 6 weeks, you repeat the tests, and if they're part of the 37%, then the tests show what they have.
Yeah, it's amazing that, and I've seen this many times before. As I mentioned before, we had a patient who was tested 5 or 6 times, from their other doctors, some infectious disease doctors, and just clinically had that sort of sense of Lyme and didn't have the bullseye rash, et cetera. Was on different meds for different things. And then when we sent it out to IGeneX and they were positive, we treated them and they had pretty dramatic benefit, pretty dramatic recovery.
Yeah.
But, a physician has to be really astute in understanding that not everything is black and white. Not everything's an on and off switch. So you have to keep your foot, inside of a traditional box, but then you've got to dance around, stepping outside the box to be able to get a better understanding of what's happening, what's going on. We see a lot of
It's a
people
very
that do well.
complex situation, as you can imagine. And so I mentioned ILADS, the International Lyme Associated Diseases Society. ILADS is an international organization, a nonprofit that goal is to train physicians and support them and their patients. And they offer physician training programs where you can actually get certified as a Lyme literate physician. So if anyone's interested in learning more about Lyme disease in a more formal way, they definitely can look up ILADS. Have article after article on their webpage. They have videos. They have a lot of helpful information, and they hold these great conferences every year, and they have these trainings. So it's not like, oh my God, I can't figure this out. No, you can. It's just like any other thing in medicine. You take some time and you learn it.
Mm-hmm. Yeah, it makes a great deal of sense. Makes all the sense in the world. For a lot of patients that we see that have a variety of odd symptoms and such, and we see a ton of people with Epstein-Barr, and I think the majority of people that we've ever diagnosed with Lyme have had Epstein-Barr or some other very common virus. They say that 90% of the world has been exposed to Epstein-Barr, somewhere between kindergarten and college, and we call it mono, et cetera, et cetera. But vitamin C IVs seem to help, and a lot of people do well with the vitamin C IVs. There is some research going back years that talks about vitamin C IVs helping to improve killer cells. So that may be in part, it may have antiviral effect. Vitamin C IVs based upon, I go on Google Scholar all the time to search research on things, and intravenous vitamin C in the search box can have anti-cancer effect, help to inhibit COVID and a lot of viruses, et cetera. So you want to be as thorough as possible.
I always say that Epstein-Barr, most everyone in America has been exposed. So if you're an adult or even a young adult and you have chronic fatigue and you're very high titers indicating active Epstein-Barr, well, why? Go back one step. What is weakening your immune system? Do you have a hidden Borrelia infection? Is there Babesia there? Do you have heavy metal?
Yep.
Is there a metabolic problem? So you don't just treat the Epstein-Barr, you try and figure out why it's there. So it's a marker itself.
It's a comprehensive mechanism. So we've been doing, and since I started practice, I got certification in chelation therapy, and we've been looking at blood and urine for metals forever on everybody because everyone has some significant exposure. So when people do a blood test at their doctor and they say, well, I had no metals, I said, well, yeah, you had no metals in your blood, the 3 seconds it took to take that blood to go to the tube to fill that tube. So it doesn't mean you have nothing in your cells or elsewhere. So that's why we don't rely as much on a blood test for metals. We'll look at urine, and we'll do a urine test, which looks at 21 metals as blood looks at 5. Then we'll also do a challenge where we do a chelation IV and grab urine afterwards to see what we're now pulling out, which typically gives you the best picture. But some exposure is staggering. You'd expect a person who has chemo to have high levels of platinum because of cisplatin and all the other types of chemo, but tons of arsenic, aluminum, lead, mercury. The numbers are crazy. It's almost, epidemic.
Well, a couple of things. First of all, any chronic illness that's inflammatory, any chronic inflammatory illness can impact in a negative way your body's detoxification process. So if the chronic illness is from Lyme disease or whatever, that person's more likely to start to develop, or harbor toxins that otherwise would have been released. So that's part of the whole thing. And The other thing is that in our environment, I mean, coffee is notorious for having arsenic in it. Chocolate's notorious for having cobalt. I mean,
Hmm.
I personally was tested very high for cobalt. I said, I'm not a metal worker. How do I get
Yeah,
cobalt? I
yeah,
realized it's my chocolate addiction. So,
yeah,
it's part of the environment,
yeah.
So I know people who are enlightened, physicians who are very enlightened, and they say, I'm fine. I don't feel sick, but on a regular basis, I'm going to take some detox protocol just to make sure I'm not building
Hmm.
things up. I don't know if that's medically advised or not, but I'm just
Hmm.
telling you what I know some people are
Well, it's
doing.
it's smart. The more you learn, the more you dig, the more you find out, the better you can be. I mean, arsenic is in chicken, shrimp, rice, apples, California wines, some South American wines. I think they spray arsenic in vineyards to kill germs. They put arsenic in chicken to kill germs, etc. Lead, mercury, and cadmium in lipstick and makeup and tattoos for the
Yeah.
ever-growing tattoo population. There's so much of it. Aluminum pots and pans, aluminum foil, antiperspirant. We see this every day. We're looking at the urine and we're trying to, get as much of this out as possible. And the protocol we use, which is proof and works well, once we see that the urine shows the metals, we'll do the IV with the urine afterwards, see what comes out. We'll do 10 treatments. It used to be 30 treatments when Dr. Atkins used to hold, rest his soul, his office gatherings the first Monday night of the month in his office, and all the doctors would come and chat and put protocols together. But I started to do 10 and then retest the urine after the 10th IV to see how much less was coming out. So we can prove that you're depleting the metals based upon doing this, but everybody's got some and, significant amounts of metals. It's pretty amazing.
Yeah. Yep.
So yeah, the patient that you see that has a variety of complaints that might end up being Lyme will probably also have metals and Epstein-Barr and a whole bunch of other things going on, or vitamin deficiency. And yeah, it's amazing.
Well, that's what I said before. I mean, if you have someone with chronic tick-borne disease, you definitely have to attack the infection, but you have to do all the other things to support the terrain, improve the immune system, improve the drainage, improve all that, fix the gut. You know, I'm preaching to the choir here, but you have to do it all. You have
Yeah,
to do it all.
you have to. Otherwise, that one treatment or singular approach is not going to create the result, not going to create that, terrific or significant long-lasting benefit or outcome.
Yeah.
What other questions do we have, Frankie?
So, if someone had Lyme's for years before getting diagnosed, is it possible to fully recover, or is there a point where the damage is permanent? That's one that's been asked a few times.
Well, if you have a damaged joint where the cartilage is worn down and the bone is bone on bone, no antibiotic and herbal is going to fix that completely. So some permanent damage is going to be there. But, by and large, in my experience, you can get these patients so much better where they can go back to function. I can't tell how many people were, not even that old in their 40s and 50s, ready to give up their careers because they figured they're just sick and they can't do it. And, proper treatment, they're back on their feet. And I've seen people, I started practice in the 1980s, and I see people today who I treated way back then who are still well. So, yeah, if it's done right, you can make the people better. In fact, some of these treatments, like Dr. Calapai likes to do, make people better than they were even before they had the Lyme. So cleaning up the terrain can really do a lot. But really, with good treatment, most people with Lyme will get a lot better. Another question is, can you cure Lyme disease? Now, what does that mean? Well, does it mean that with all these treatments, every single spirochete germ is gone and never to come back? Well, I don't really think so. I think there's always going to be some that lingers. So the goal of treatment is to support the system on the one hand and decrease the spirochetes on the other hand,
Mm-hmm.
so that you get to this balance where your body can stay healthy. And in my experience, if someone can stay healthy and not have a relapse for 3 years after the end of treatment, they're never going to relapse unless, of course, they get bitten again.
Yeah, that's important to think of. It's got to be a comprehensive approach, comprehensive mechanism. More and more people today, I think, are more conscious. They're reading more. They're coming in with articles. They're going online and they're reading more and more information. So I think the information age that we're in, we're able to get, a ton of info, usually good info. Sometimes it's not that great. Off the internet is allowing people to get a little better understanding as to what to do or what's going on. And of course, there are people who read, oh, I saw this online and this is what it said, and it's completely bogus information. But, people I think are more interested in learning and reading now than before, especially people who have chronic disease who've had issues that are not getting better, and they're not happy with the traditional, singular approach. So that's
Well,
why it's so important to get this out.
yeah, but it's also a double-edged sword. Let's say you have Lyme, which is a multi-system illness, and you start to get sore joints. So you go to the orthopedist, and maybe he'll send you to a rheumatologist. And then in the meantime, you're starting to get tingles in the nerves. And so you're going to see someone who maybe is a neurologist. And then you have terrible headaches. So you see ENT says it's TMJ. And then you're having funny things with your eyes. You go into the eye doctor. And then you finally get to someone who looks and says, wow, you have all these complaints. You've been to 15 different doctors. It's been going on and on and on. You're probably histrionic and is like a mental condition. The people get dismissed. So the problem is you can be so diligent and learn as much as you can and come into the stack of articles and right away, bam, you're labeled as being some kind of a cuckoo.
Yeah, yeah.
So that's why it's so important for people to seek out real information like from the Lyme societies. Find a Lyme literate practitioner and get treated. Things happen for a reason. It's so frustrating to me to see these people sick. They could be fixed.
Yeah, it's incredible that people all the time, and I see they're so told that they have anxiety or depression or put on meds, which never really help them, and they have something else, or we'll figure out they've got something else going on. So it's a
nowadays
shame.
they find that depression is an inflammatory disease of the brain, and the better antidepressants, although they affect serotonin and so forth, they also are anti-inflammatories. And so we know that inflammatory infections like Lyme, toxoplasmosis, Bornavirus, all can cause treatment-resistant depression, especially Bartonella. So if you have a patient with truly, a depressive illness, again, find out why. If this person is completely fine and out of the blue, they get depressed with no other major changes in their life, think about the underlying cause.
That's one of the issues that most people, and I have too, with doctors just using a prescription for whatever symptom, people describe or talk about. And who wouldn't be depressed or anxious if they had a variety of weird symptoms that nobody could figure out that, they couldn't help or couldn't fix or wouldn't go away with a lot of different treatments out there? Anybody would be anxious or depressed.
Yep.
And just a last question from the chat. Can Lyme disease affect pregnancy, and should women who had Lyme take extra precautions before trying to conceive?
We know that Lyme can infect the mother and the placenta and the baby, and can be obviously transmitted from mother to baby.
Wow.
It's also been found in breast milk, and that's an unpublished study that involved 4 different women on different testing. So what do you do? If the mother gets a tick bite and gets Lyme disease during pregnancy, then that's almost a medical emergency, because you don't want the problems that come from gestational Lyme, which can be stillbirth, can be developmental problems, can be born septic, and all sorts of problems. Even heart defects have been related to chronic Lyme, or inborn Lyme. So if the mother gets a tick bite and becomes infected during pregnancy, then she definitely needs aggressive treatment, because you're treating 2 people. If the person had Lyme previously and is completely well, the risk is incredibly low to the baby. But I would still recommend that persons see a Lyme literate physician and get the proper testing done, and just a good history survey. Sometimes you learn more from the history than from all these tests. If someone has Lyme and is still symptomatic and they get pregnant while they're symptomatic, and the thinking is they're symptomatic because they're still infected, then the treatment that a lot of people do, and what I had recommended also, is you treat during the whole entire pregnancy. You test the baby at birth. You have the placenta analyzed by a pathologist. You test the cord blood, the baby's urine. There's no point in testing the baby's blood, because their blood reflects the mother. Their own immune system doesn't mature till much later. So for the babies, we do urine testing, looking for antigens and DNA PCR. And I've done studies on that also. In fact, the Lyme Foundation used to keep a pregnancy registry, and we found that over 13 years, if the mothers were treated during the whole pregnancy, despite having Lyme, there was not a single baby that had a problem. So it really does work.
Wow.
Really does work.
Yeah, with a lot of women that come in that are talking about getting pregnant, and they say, I want to check my vitamin levels, I want to check everything. I know it's important, certainly, to do that. And certainly for infectious disease, it's you don't want that to be there, And for a lot of women, I know that they put off getting pregnant a period of time just because they wanted to get their body as healthy as humanly possible. Makes sense.
Yep.
Okay, some terrific, terrific information. Just want to chat once again, the AccuDart Health test. I just looked on my phone, AccuDart Health, so people can look that up and understand that they can gather some information, get some of that testing done. IGeneX is a wonderful lab out in, it's California, correct? Or is it, I know it's out west.
California.
In California, so to utilize those labs, if you're seeing a doctor and he's treating you for Lyme, you can ask him about doing testing through IGeneX. It's just better testing, more variants of the Borrelia organism. Wonderful, wonderful information.
And their immunoblot test, which is their premier test, has now gotten FDA clearance. So it's not like one of these, I don't believe that lab, everything's always positive. No, it's been FDA cleared. And during the validation studies, they were superior to the comparator that the FDA has used for years, decades. So if people worry about immunoblots, don't worry about them. They're really good tests.
Excellent. A lot of great information we need to know. We'd love to have you back on the show and give us updates of the wonderful things you're doing. I'm sure everybody has the same feelings that I have. That you've done a wonderful job your entire career and have continued to do that, and we're very thankful for that. And,
well, I have to say that about you also. I mean, we need more doctors like you too.
Thank you.
And I mean that, seriously.
Thank you. It's always a pleasure to talk to you. We have to meet for dinner one of these days.
Absolutely, but you're paying.
Yeah, I will. Not a problem. Absolutely. I just spoke to Frankie, and we have our Saturday program. We've reached some crazy numbers because we also are on Rumble and LFA, Live from America. And on Saturday, a week or two ago, we had 115,000 views. And we're going to play this program on Saturday and be able to put it out there so more and more people can see this. And with any luck, hopefully we'll try to get a midweek program started with them because they have staggering views nationwide. So I want to keep delivering wonderful information, to all of these people. And of course, all the information that you brought to us has always been wonderful. So great talking to you again. Great seeing you again. And thank you so much.
Likewise.
Thank you. Have a
My
wonderful
pleasure.
day.
Thank you so much.
Okay, buddy.
Bye.
Wow, what a great interview.
That was
one of the best of the best. Yeah, I've learned so much over time, from him, and it's helped so many of my patients. And even beyond the patients that he's seen, all the other doctors that he's, trained and worked with, and all the research that he's doing is amazing. It's wonderful.
I learned a lot.
Yeah.
And, he says, one dose, I'm about to get a bunch of blood tests.
Yeah. Well, like anything else, there are people who just know more because they've put the time and the effort and the research into learning as much as humanly possible and understanding as much as humanly possible. And, you just get better outcome, better treatment that way. Yeah.
And I will say, the chat has their questions, but they certainly comment more than they ask questions, and people just loved that program. So we're definitely going to run that again on Saturday.
Yep, we'll do it, and we'll keep putting out great information like this. We have a bunch of different doctors to talk to. However, I think Dr. Brascano is the best of the best, so it was wonderful to chat with him again and to get him, on the program. So we love to have him be a regular contributor, and, I want to get him on the LFA so people can hear about that.
It's a good guest when we tell him, I'll be 20, 30 minutes. It's been an hour and 10.
Yeah, so it's just the volume of information there is terrific. It's huge. So any other questions or comments?
Let's take a look. People are saying good things are coming. That was fantastic. Let's see what else we got. We actually have some more Lyme questions coming in. Mm-hmm. How important is early treatment? He ended up answering most of the questions.
Super important.
Yeah.
Because as soon as you're exposed, and as he was saying, traditionally doctors still think the way that they thought back in the 80s, which was just early information. You're testing one test that looks at one strain of one bug, and not looking at all the cofactors. So you have to get early testing. And the fact that the creature within minutes can give you the germ, the Borrelia, and you don't have to see the obvious rash, and you don't have to have overwhelming symptoms that day, that minute, that week, or that month. you've got to get tested early, and you got to get tested multiple times. This is what we've done, of course, but you've got to get tested, look at your immune response, look at the CD57 test, recheck those Lyme parameters, the immunoblot or the IGNX test or the AccuDart test within the 3 to 4 weeks, and you're building a case for either a yes, a maybe, or a no on a very significant bug. If it comes out a no, terrific. But if you've done the thorough tests and that's the outcome, great. You've done testing, you prove that it's not a problem. If it's there, it's a problem. Then we have to go through specific protocols to create your best outcome.
Right. And one question people were asking when he was discussing the botanicals, not a pre-med guy here, just the producer, but is he referring to plant-based medicine?
Yeah, probably plant extracts that may have some, kill effect.
Yeah, that's what I figured, but a couple questions on that. And yeah, it's just insane because, for us, we're on Long Island and now, this has been such a crazy thing on Long Island for so long, but now everyone,
Now, I know a lot of stuff, and I know you know a lot of stuff. And we're both very interested in learning. That's our everyday thing. I want to learn as much as I can, get good information out there. I did not know that 1 in 7 people in the world are dealing with Borrelia-related organisms. In the world.
Insane.
Years ago, when I started learning about all of this and we started seeing patients and working with them, and, we use a comprehensive approach and do the vitamin IVs and the meds and such, again, greatly influenced by his protocols, I didn't realize that Epstein-Barr was a frequent partner hanging out with Lyme and Babesia, Borrelia, and some of the others, but that became evident over time. And it's just amazing to me that many people can be exposed. I thought that, and everybody else did, Connecticut, Long Island, okay, Pennsylvania, wooded areas. Then all of a sudden, literature came out everywhere, every state in the country. And yeah, there are more in certain states, granted, but then all the European research and research all over the world. And now it completely, shocks me to the core that 1 in 7 people in the world have some Babesia organism issues.
Insane.
That's just staggering. And of course, different strains here, different strains there, multiple co-infections. It becomes a little bit overwhelming to think about. But now, certainly for myself, just as with Dr. Briscano, it's a battle. We've got to learn more, fight better, do it smarter to be able to get better outcome and better results for patients. So learning new things, adding new things, the new testing that's available. We're going to set this stuff up tomorrow. And those people that want to do the AccuDart test, AccuDart Health, I would do it. It is, however, a shame that whoever makes decisions in New York will not allow these tests to be done in the local doctor's office.
Not the first time we've seen this problem.
Yeah. You've heard this before, but every other state allows, and I'm thankful that these tests can be done and people can order them online. But again, remember the big workup. That's, of course, what we do and we've always done, looking at your vitamins, minerals, hormones, the big immune picture, the viral, the heavy metals, all of that is the first step. And then looking at some of these other wonderful tests can make a big difference. But pretty scary.
Yeah.
I don't get scared of too many things. But 1 in 7 people is pretty scary.
Terrifying. Absolutely terrifying.
I thought that 90% of people being exposed to Epstein-Barr was, and that's a gigantic number. It's the biggest number for any bug that there is. But yeah, maybe that's setting the stage for a lot of other things because Epstein-Barr is a protein called LMP1 that makes your immune system weak. Now, this is making my brain run fast now thinking about what he was saying. Why is Epstein-Barr there? Is it potential that Lyme is there and that's allowing Epstein-Barr to thrive or vice versa? Look at the people who take antibiotics for different things, and doctors give antibiotics out like candy. What if a person does have Lyme, has no idea, and they take an antibiotic for something that is just a sore throat that they feel or an earache or a headache, and that decreases the symptomatology or some of the testing for Lyme, it's there's so much to this.
Especially, when you actually are able to look at how small they can get. I've always seen the ticks. I've picked ticks off, but last summer I walk through. I do a little. I'm just walking through the beach, and then I look at my hand. I say, "Oh, that looks like a weird beauty mark."
Yeah.
And then I look close. I'm like, "Oh, what? That's got
Whenever
legs."
you're out and about outside, and I do this with my buddy Mike. We go fishing, off the beach in Montauk all the time, and you get a 4x4 pass. I take my truck and drive it on the beach. He's got one. He's got a camper on it, so we have everything we need. We catch fish and such, but you always have to have someone check out your back and look all over, and you do for them as well, because these things are everywhere. And Montauk is a crazy place because it's the only place I've seen the thickness of shrubs and bushes. You can't look 2 feet into the bushes and shrubs in Montauk because it's so thick. There could be a deer. You could be standing 2 or 3 feet in, not that you'd want to, and no one would be able to see that because the shrubbery is so thick. Imagine the ticks and the bugs that are there.
Yeah, and most people who own property there, those shrubs and things, like they are part, especially people who are on the beach.
Oh,
like
yeah,
the government are like, you can't move that because then the land's going to fly away.
Yeah.
So it's not going
Or
anywhere.
just to block view of their house. They use it, as a for the aesthetic, but still. I'd be hard-pressed to want to live in Montauk with all that going on.
Unless you're going to give me a house, I'll be there.
Yeah. You have to wear white clothing that, cinches at your ankle. You look kind of funny, but... Okay, are there any other questions, Frankie?
We're all good. People just love this.
So-
They love it. So
Terrific day. For those of you who want some info, certainly you can give us a call at the Garden City office, 516-794-0404. And the website is drcalapai.com, drcalapai.com. You can look at a lot of information that we have there. We'll put up more information month to month. We're going to be sending out a nice email because the people that help to run the website are doing that for us. So our May email is going to go out within a couple of weeks. And people, if you'd like to be on the email list, just call the office and tell us. We'll put you on our email list, just as we like to, chat with people back and forth while we're on the podcast here. Send us your email information, and we'd love to get you up and send out some info. We're going to put some great information about Lyme disease as well, based upon what we're talking about today with Dr. Briscano. Friends, thank you all for listening. God bless you. Have an amazing day. And we'll be here on Friday to chat with you, and again on Saturday. So Mondays and Fridays, 12:30, Saturday, 2:30.